Hello everyone! In this video, we will cover an overview of some basic principles of computed tomography, such as image reconstruction and back projection. The X-ray radiation produced by an X-ray source go through the patient body. The X-ray tube and the X-ray detectors rotate around the patient bed. The detector here plays the same role as a photographic film in a conventional X-ray radiography. You might remember that every part of the body attenuates X-ray radiation differently depending on the density of the organs and tissues. The role of the detector is to measure the amount of X-ray radiation passing through the different organs and convert the radiation intensities into electrical signals. Those signals are then processed by a computer using different algorithms to create CT images. If we use a simple X-ray system, only a two-dimensional image can be created. However, with CT technology, by measuring X-ray radiation going through the body at different angles, we can now make three-dimensional pictures. The computer here plays a key role splitting up organs in the body into small volumes called voxels. A voxel is a three-dimensional equivalent of a pixel. Now that the data have been acquired, the next step is to produce the images. The electrical signals measured by the detectors are reassembled together with a computer software creating images. For example, in this figure, each voxel from a scanned body part is allocated a number, also called an attenuation coefficient number, mu. The mu value represents the level of attenuation of the X-ray going through the body parts. The X-ray transmission measurement Ni represents the sum of all attenuation values from all voxels in each tissue slice. For example, the voxel from bone will have high mu value due to their high attenuation of X-ray radiation. But the voxel from skin will have low mu value, as the skin has very low X-ray attenuation. Let's take an example of voxel from a tissue slice. I have assembled them in 2 rows and 2 columns. I have also assigned some random attenuation value of 3, 5, 1 and 8 to each voxel. In this case, a value of 1 will represent no reduction of radiation intensity, meaning a low attenuation of X-ray by the tissue. A value of 8 will represent here a maximum attenuation of the X-ray. The X-ray passes through the tissue slice at different angles. 0 degree will come from left to right, 45-degree angles, diagonal, then 90 degree from the top to the bottom, and finally 135-degree angle will be diagonal on the other side. Each attenuation value will be expressed as a sum of the voxel attenuation value along the radiation path. So in this example, the new attenuation value after X-ray radiation from the 0 degree angle will be then 8 and 9. From 45 degrees, the new value will be 11. And then, from the top at 90 degrees, the value will change to 4 and 13. And finally, at 135 degrees, the new value will be 6. An agreement from the earliest days of CT is to replace the name attenuation value by CT numbers or Hounsfield units. The Hounsfield unit is a concept that we actually will discuss a bit more during this course. To understand back projection reconstruction, let's try with another example here, showing a CT scan of an object. This object has 3 different attenuation materials. The attenuation value from each view taken at different angles are divided evenly along the path of the ray, showing here. This process is called back projection. In the figure C, As you can see, after back projection, the four views are summed together. And here it's a different direction. And an image of the test object is beginning to appear. It is quite blurry at first, but the quality of the image can be improved by using a mathematical process such as filtering. To understand the importance of filtering, let's compare two pictures. The first picture is a CT scan image of an object before mathematical filtering. And here is the same picture after filtering. As you can see, the image becomes much sharper. To summarize, in this section, we have covered some of the basic principles of image reconstruction and filtered back projection for computed tomography. If you want to learn more about these topics, you can view Dr. Andrew Janke's presentation in the Advanced Topic section.